ki te kōrero I te wānanga pūa, whia pūtaka te marama hunaku, ka tako koutou I te wao atu. Tū te wini, tū te wana, kia whakaputai ki te whai au, ki te ao marama. Tū numia, tū rawea, whakoti tuku, whakoti rangi, o te whare tū nei, whano, hera mai te toki, taungie, huie, taungie.
You know, being Minister of Health really is the best job in government. You get to work with quality people every day, people who are really dedicated to the work that they do, and that's what makes this job so exciting. As I've said to some people previously, I wake up most mornings and turn to my wife and say, oh, imagine being Minister of Education. What's also great about being here today is just to associate myself and the government, and can I just start off by bringing an apology from Maggie Barry, the MP for the North Shore, who's unable to be here, but also to associate the government with what you've described as the renaissance of the North Shore Public Hospital. And many people will forget just what it was like 5 years ago, and some of the descriptions. In fact, the New Zealand Herald described the North Shore Hospital Emergency Department as the weeping sore of the New Zealand Public Health Service. Well, these folk here have, together with you, led just an enormous transformation in the North Shore Hospital and the Waitemata DHB at that time. And our team in Wellington have backed you with that, with funding for the the new emergency department, the cardiac centre, the new renal unit, new car park, the new assessment and diagnostic unit, new Ward 2, new MRIs on the way, multi-billion-dollar new mental health service building is on the way as well, and we've still been able to find the money to paint the building. So this has really been tremendous. Look, here's the reason why we need to have elective surgery centres in New Zealand and more of these. And we've learned from our experience down the road from the fantastic people at the Manukau Super Centre, Clinical Centre down there as well. Look, there's just huge demand in New Zealand with our ageing population for elective surgery. Just more and more New Zealanders wanting the relief of pain and the restoration of wellness. And that's why investing in elective services is so important. And all around the world, the international trend is separating emergency care, acute care, from elective services. And so when the government came into office, we said we wanted to build more dedicated elective services for New Zealanders, and the first group to put their hand up were the people from the Waitemata DHB who said, look, we think we could do this completely differently and provide a much better service for the people of our region. And so the group here piloted their approach at Waitakere Hospital and saw a massive lift in the productivity and the level of service that they could provide New Zealanders for the amount of money that was being invested. And this is really important, because at a time when health funding isn't going up as much as it used to, we have to get every best use of that health dollar as we possibly can. And with an ageing population, more of that has to go into providing the elective surgery that New Zealanders want. And that's why we want to back the innovation and the future focus that we're seeing here at the Elective Surgery Centre here in North Shore Hospital. Already the model of care that you've proposed has been acknowledged with an award at the Public Service Awards, I think last week in Wellington, for an innovation that's made a huge difference to people. So thank you so much for the opportunity to be here and to share some time with you today. You know, with all of this stuff that we're doing, it's worth reflecting, as Dr. Levy said, the most important thing in all the work that we do is the services and the care and the compassion that the health service provides individual patients and their families. And this is about relieving pain, relieving suffering, restoring wellness, and allowing families to get back to the lives that they all want to live. And I just want you to know, especially all the clinical staff and the management team, that on behalf of the patients of New Zealand, we really salute the dedication and commitment of so many of you to the New Zealand Public Service and the care and compassion that you provide patients. I wish you all the very best for the work that you do. Have a great weekend, and look forward to, no doubt, very, very busy times here at the Elective Surgery Centre as we just have that big lift in care for New Zealanders that so many of us desire. Thank you very much. Kia ora.